Hi, this is Dr. Fox. Let's talk about the nose, mouth, and nasal and oral cavities. In this video, we'll discuss those portions of the respiratory system that are going to move air in and out of our system. In particular, we'll discuss the external features of the nose and the features and functions of the nasal cavity. We'll also discuss the mouth and the muscles that affect the oral fissure versus the movement of the mandible. And we'll describe the oral cavity with an emphasis on ventilation. So let's begin with the nose. The nose is exclusively a respiratory structure as we interact with the world. It is true you could put a nasogastric tube through someone's nose in order to feed them, but that isn't the default state. We predominantly are going to use our noses for breathing. Everyone's nose is a little different, but many of us have the same basic major parts. So when we're looking at the nose, we can see that there are bilaterally paired nares or nostrils, and they are supported by fleshy protuberances called ala, which means wings. These are coming down from the bridge of the nose. And at the very bottom of the nose, the inferior surface between the ala, is a little bit of skin called the nasal columella. And that nasal columella is going to be in line with the nasal septum, which divides the nasal cavity, as we'll see. So let's take a look at the nasal cavity. And we have this nice sagittally sectioned donor to lead our discussion. So there is the nares of the right nasal cavity. And from the nares, we enter into a space called the nasal vestibule. The nasal vestibule would be the part of the nasal pathway that is outside of the cranium. So when you think of the cranium, which is the skull without the mandible, that division is going to be right about where I drew it there. The nasal vestibule is that space in which dried mucus can form. You might refer to them colloquially as boogers. So if someone's picking their nose, usually they're digging that out of their nasal vestibule. Now, distal to the nasal vestibule is the nasal cavity. It's all of this here. That nasal cavity is divided into two cavities by a nasal septum, which is a collection of cartilages along the midline that's covered by mucosa. When we look along the lateral wall of each nasal cavity, we see that there are elaborations of bones. We call these nasal conchae. So there is the inferior nasal concha, and below that, the inferior nasal meatus. And then there is the middle nasal concha, and below that, the middle nasal meatus. And then the superior nasal concha and the superior nasal meatus. All of this serves to increase the surface area of the nasal cavity. And all of this is lined by nasal mucosa. And so as you bring air in through your nose, that mucosa has the opportunity to warm the air and to moisten the air and to trap any impurities in the air within it. And then the mucus that's produced by that mucosa can flow, hopefully, out that way, or as you sleep, back that way. The nasal cavity is separated from the pharynx by the choana, plural choanae. So we refer to these as the internal nares. So the external nares are your nostrils, your internal nares are your choani. So let's take a look at the septum and these nasal meatuses and conchi. So here we have, coming down, the nasal septum. The nasal septum is a cooperation between a couple of things. Predominantly, though, it's formed from the perpendicular plate of the ethmoid bone. That's this bone that's sitting superior to that. As we move more posteriorly, that septum is more bony, and that's from the vomer. Now, as we look laterally, we can see how elaborate these conchi are. So there's the inferior nasal concha. That's its own bone, that's its own ossification, and you can see the opportunity for air to surround that. As we move superiorly, the middle and the superior nasal conchi are elaborations of the ethmoid bone. So different conchi have separate centers of ossification, the inferior being their own bone, the middle and superior being of the ethmoid. Now, these meatuses serve as an opportunity for communications between the paranasal sinuses. Those are the hollow spaces within the bones surrounding the nasal cavity. So here we can see the frontal sinus. We can also see the sphenoidal sinus. There'd be a maxillary sinus deep to there, and an ethmoidal sinus deep to there. And so all of these sinuses can communicate with the nasal cavity through spaces or ostia in the nasal meatuses. There's also a communication between the outer portion of your eye and the inferior nasal meatus, and that's complements of the nasolacrimal duct. So the nasolacrimal duct runs from the medial canthus, the medial side of your eye, down into the inferior nasal meatus. Fun fact, when someone is crying hard and they get snotty, there is an increased production of nasal mucus with crying, but you also have tears mixing in because they're falling through that nasolacrimal duct, being conducted down there and mixing with their nasal mucus. Probably not a good idea to share that fun fact with someone that you've made cry, though. Next up, we have the mouth. The opening of the mouth is the oral fissure, and it is surrounded by a muscle called the orbicularis oris. Orbicularis means that the muscle fibers are more circumferential like that, and oris refers to the oral fissure. This is a muscle under the control of the facial nerve because it is a muscle of facial expression. So that's cranial nerve number 7. Also affecting movements of the mouth are muscles such as the masseter, the temporalis, as well as the pterygoid muscles, both medial and lateral, which would be deep here within the infratemporal fossa. These are muscles of mastication. So to masticate is to chew because they elevate, depress, retract, or laterally move the mandible. And these are under the control of the mandibular nerve, which is V3. It's a division of the trigeminal nerve, which is cranial nerve number 5. So this is the Roman numeral for 5, but we refer to it as V3 because it has 3 divisions. An ophthalmic division, which is V1, a maxillary division, which is V2, and this mandibular division or nerve, which is V3. And V3 is what controls how your mandible moves. As we go through that oral fissure, we enter into the oral cavity. And the oral cavity has three major parts. There is an oral vestibule, an oral cavity proper, and a sublingual space. So let's take a look at these three divisions. Now, as you move through the oral fissure, but you're still outside of the dental arcade, or the teeth and the gingiva, you're in a space called the oral vestibule. It's into this oral vestibule space that your parotid glands will secrete saliva, just adjacent to your maxillary second molars. We have our teeth supported by gingiva here. These are important for the digestive system. And then inside, so beyond these teeth, we have the oral cavity proper. And that goes all the way back to the palatoglossal arch. The palatoglossal arch are two palatoglossus muscles that are invested by mucosa. And so that is the posterior or the distal boundary between the oral cavity and the oropharynx, which is a part of the throat. The tongue is going to be a common organ between both the oral cavity proper as well as the oropharynx, in the anterior 2/3 of which exists in the oral cavity, the posterior 1/3 of which exists in the oropharynx. Deep to the mucosa here, all the way down to a muscle known as the mylohyoid, we have the sublingual space. And that sublingual space is where we can contain the sublingual salivary glands. We can have the duct for the submandibular glands. We could have all of the neurovasculature that supports the tongue moving through there. And so it's a really interesting space that's a little more germane to the digestive system. So let's take a look at these spaces on our donor here. Here is the nose, and we don't have the opportunity to see the nares here, but it would be located about there. Here is our nasal vestibule. We could also see along here, that's the inferior nasal meatus, the middle nasal meatus, and the superior nasal meatus. Back here to the concha. Then we have our oral fissure surrounded by orbicularis oris muscle. We can see our oral vestibule here. This particular donor was edentulous, so I can't see teeth here. And then we have our oral cavity back to about there. And so this is the oral cavity portion of the tongue, followed by the root of the tongue, which is in the oropharynx. And then deep to this tongue here, that's where our sublingual space would be. So we've discussed the nose and its features both externally and internally. We've discussed the features and functions of the nasal cavity. We've discussed the mouth and the muscles that both affect the oral fissure as well as movements of the mandible. And we've discussed the oral cavity with an emphasis on ventilation. Thank you so much for your time, and I look forward to talking to you in the next video.